I do not view our doctor as our direction. I view us here with what we know about the patient relationship from his previous home as the guidance for how his care should be going. And then I'm providing those recommendations to the doctor like, hey, this is what we want to do. Can you align with this? Okay, because I got the time.
Talk about the necessity to, as an owner operator, understand the iBudget handbook, understand patient care, and understand the plan of support that the patient was previously under, and the conversations that you've had to have with the doctor, with the different medical professionals involved in the care currently, who've maybe tried to make some shifts, some adjustments, and just how you have to be an advocate for the residents in your home because they very well could get lost in translation.
Well, yes. So I'll use one patient, for example. They came from a home that they had lived in for 10 years since they were 16 years old. And now they're at our home with a new doctor. When a doctor comes to the home for a visit, the doctor is here for maybe 15 minutes, but they're actually interfacing with the patient for maybe 5. Y'all all been to a doctor's visit. You know they're not spending no time with you. So you come in and out, you look at him, I answer some questions, and then you're trying to make decisions and write prescriptions based off that. I'm not okay with that. So, for example, my doctor tried to change an antibiotic that my patient was on just because she was just like, why is he on this every day? I'm like, good question, doc. Shouldn't you know that? Have you not reviewed his previous records? She had it. And so then she was gonna take him off of it. And I was like, no, wait a minute. So I reached back out to his previous doctors, his previous home, so I could understand why he had that particular medication. And once they provided me the info, I called the doctor back and was like, here are the justifications for why he needs this. I don't want to remove it for him. But if I wasn't like aware enough to know to question and push back for the doctor, and I was just like, okay, this is something that could have, screwed with his homeostasis right now, where this medication has been in play for 10 years and he's been stable. I wouldn't want to remove that and create some instability. And although it's an antibiotic, it was being used for gut motility. It was an off-label use, which he needs help with gut motility. So being able to research, get that information, shout out to the importance of maintaining relationships with whoever you meet in this, because the ability to be able to call his previous home and have these discussions has been like, a godsend every time I've had to do it. And then, advocate for him to this doctor who's been here for 15 minutes. That's important. And I think you need to be that involved in understanding what your patient actually needs and being the best and loudest voice for them. Because a lot of these people that come in and out of the homes providing services, that patient is one of who knows how many they're seeing every day. So whoever's in your home, they need to be your number one. Even if it's 5 of them, they all need to be your number one, and you take the same steps and do the same level of due diligence and advocate for them to make sure they have what they need and that arbitrary changes aren't being made without a solid justification. So I do not view our doctor as our direction. I view us here with what we know about the patient relationship from his previous home as the guidance for how his care should be going. And then I'm providing those recommendations to the doctor like, hey, this is what we want to do. Can you align with this? Okay, because I got the time. They may not have the time to do the level of research they need to do. They they're not going to get in 15 minutes, but we're here with him 24 hours a day. So I feel like we know what's best first, and then we reach out to that doctor to collaborate to make sure that what we're thinking aligns with like medical necessity and their expertise. But you definitely have to guide that discussion to make sure that all things are considered.